In the first aspect, we talk about how it affects and why should we be interested. It affects a great number of people. It can be prevented, but it's still spreading. No one can remain unaffected. It has no cure, and it virtually kills like any other. What about the history? First described in 1981, has now reached every country in the world. Most at least are the youth, 15 to 24, women and children. Fourth largest cause of death worldwide, and leading cause of death in Africa, and especially Nigeria and South Africa. If you see what I put here, adults and children estimated to be having HIV. If you look at it very well, you look at the figure there, and you see this. You see, I continue to ask myself, and I tell people wherever I go to talk, I tell people, one thing I know, I may be wrong, but that is my own personal opinion. And I think the human rights lawyers will bail me out here because I'm entitled to read. There are two major things that you see in this world, especially things affecting black man. I'm telling you, my brothers and sisters, I'm not saying that the HIV is not really a problem, but it's a problem, there is no doubt about it. But imagine the number of people that also die from malaria. If the sponsors of HIV/AIDS, if they are spending half of that, by now we would have gotten what is called anti-malaria vaccine. That is by the way. Because a lot of money, a lot of energy, a lot of research is on this HIV. It's everywhere. If you know how much WHO, UN, and the rest are spending on it, my brothers and sisters, you will be surprised. Adults and children on it. Estimated number of new infections, that is it. And when you look at the total number, and look at what Africa in particular is having. It's unfortunate that the thing is not large enough so that people at the end there will be able to see it. But I'm trying to go through and try to explain as fast as possible. Look at, that is Africa for you. 3.2 million out of a total of about 4.9. Estimated adults and child deaths. Look at the total, and you will see what Africa is having. Look at about 2.4. That is for Africa out of about 3.1. So, what about the history as far as Nigeria is concerned? I know my sister here probably must have told you about it because I met her talking some aspects of HIV also. But nevertheless, I will tell you that first reported in Nigeria in 86 in a 13-year-old girl. This is the prevalence, and it has been going up, and it got to a stage, the thing came down, and later started rising, especially in Ogun State. I'm sure she must have told you that. This is the HIV prevalence state by state. You can imagine. See where is Ogun here? This is Ogun. This is Ogun. You can see. But at least we are still better than some of these other states, isn't it?
Yes.
We are still better than them. But this is Ekiti, it's far better. But when you look at this, what I want you to see here is why is it in Ogun State compared to a place like Ekiti? And when you look at in Ogun State, I'm sure she must have also told you, and some of us here, I know we are also aware. I'm just taking it, for example, in Ijebu-Ode, Ijebu areas, it's more. Why? It's probably because of the institutions you are having around. You have the school of nursing is there. The let's say is there. Asogoye is there. National is there. Omu is there. Everywhere. And you have some of these people, they may not necessarily have how to cater for themselves. I have it here, south, zone by zone. This is southeast. This is southwest. That is south-south. Northwest. That is northeast. What I want to prove or show you here by showing that is that when you still look at it from one zone to another, there are a lot of differences in some of these things we are talking about. But nevertheless, let me just move. I will want to show you where yes. HIV/AIDS. The meaning. Because we are not actually in academic session, that is why I'm skipping some of those things you saw me skipping. HIV/AIDS. I must explain to you the meaning. Human, why is it? Why age of it? Is because it's only found in human beings. I, immunodeficiency, makes the immune system highly deficient. V is for virus because it belongs to the virus family. A, acquired. It's never inherited. It's quite like unlike when you have SS disease. I, immunodeficiency. I, immuno, then D for deficiency. It weakens the immune system. Then S is for syndrome. That is how we got this HIV/AIDS. Now, HIV-1 and HIV-2. When you have someone is said to be having HIV/AIDS or HIV, there is this what we call HIV-1, then HIV-2. Both are transmitted through the same routes, associated with similar opportunistic infections. That means whether you have HIV-1 or you have HIV-2, it doesn't matter. If it is malaria you are going to be having or pneumonia or whatever, it's still going to present the same way. But one thing I want you to see here is that HIV-1 is more common worldwide, while HIV-2 is found primarily in West Africa and places like Angola and Mozambique. I want you to notice some of the things I'm telling you now. Differences between HIV-1 and HIV-2. One is easily transmitted, and that is why it is very, very and highly common. This one is easily transmitted. While HIV develops more slowly. HIV-2 is very rare in MTCs, that is mother to child transmission. It's not common. But what am I trying to tell you is that there are two different types of HIV. There's what we call HIV-1 and HIV-2. I had my sister talking to you about how it's transmitted. HIV cannot be transmitted through coughing, sneezing, insect bites, touching, hugging, water, food, kissing. Up and on like that. You have so many ways. But I used to tell people, one of these, when they say kissing, HIV cannot be transmitted through kissing. We need to be careful. Because there are different types of kissing. Yes, there are different types of kissing. You have what you call the English kissing, the French, the African, and some other types of kissing. In fact, there are more than 10 types of kissing. So, here, although it is included, but we need to explain to you that it can also be included or excluded, depending. HIV infection and progression to AIDS. You don't need it. What about the opportunistic infections and conditions associated with HIV infections, stroke AIDS, tuberculosis, herpes, that is cold sores, genital herpes, pneumonia, recurring fungal infections on the skin, the mouth, throat. Especially, in fact, my brothers and sisters, if you see a typical HIV patient, you may not even want to eat because of the type of presentations it's going to give you. You may not want to eat because when you see the rashes over him or her, including the mouth, you will be surprised. And that is the more reason why we should be very, very careful about this issue. Unexplained fever, septicemia. In fact, it can present in any form. This is the HIV. We are just assuming now. Here, maybe through sex, blood, or whatever, it gets into this person. This is what is referred to as the window period. The fact that this person is tested negative does not mean that the virus is not within the person. And here, you still see this same person. He's still a healthy carrier. He can do whatever he wants to do. But if this person is not taking drugs, I know some people, they have HIV. And you tell them, they say no. They say it's not true. I think I heard my sister here, when I got him, saying that there are people that have HIV for the past 10 years. I think I heard her say that. I know people who have HIV for the past 15, 20 years. But if you take 1994 or 93 now, that's about 20 years, isn't it? Yeah. 20 years. And I can bet you I'm not joking. He's even a medical doctor. He's a close person. You see her, him, he's a man. You see him, you will never believe that he has HIV. And that is the simple truth. That is the simple truth. He knows how to take care of himself. He knows how to take care of himself. It's quite unlike some people who believe because they have HIV, somebody gave it to me, I must give it to battalions of people. That person will die before you know what is happening. Because what is regarded or what is said about mutation will always take place. Have we always wondered why HIV is always difficult? Why people don't get, or scientists rather, they are unable to get a drug for it? When you have a drug, let me just explain something to you for about 2 minutes. When you have malaria, for example, or you have, let me say, typhoid, what happens is that they go into the lab, they manufacture a drug, that will key into it. Drug and organism, either virus or bacteria or whatever you call it, is like a lock and key. It's like a lock and key. If you take a key, a particular key can only open a particular one. If you use that key to go and open another one, it will not open it. So what happens is, if you take an impression, it's like, I don't know how many of us have been to dental hospitals or dental clinics before. If they want to give you an artificial teeth, they will take what they call impression. When they take that impression, they go to their own lab, get you an artificial teeth. But I can bet you, if that structure is removed, by the time they break it, it will not fit into it. So what happens most of the time is that before scientists come out with whatever drug they think is going to key or open or lock the virus has mutated, has changed its form. So when the drug now got there, invariably it doesn't work anymore. That is just the simple physiological aspect of it. That is what happens. And that is why it's a little bit still difficult to get it. But my quarrel with what some of my friends I continue to say is that they can still do better. What about the malaria? So if by the time this virus gets into that person, it moves like that, and by the time you get to that one, you will discover that this same person can still walk. He's still working. He doesn't feel anything. But if he doesn't take his drug, and is pretending as if he doesn't have it, it's going to happen to him or her. This is what is going to see. These two. Compare this one to that. I have a close patient about he died around February this year. He's very, very rich. It's about 12 years HIV, about 12 years ago. I'm just sharing some of these things with you. I told my brother, I said, look, I don't like the way you are behaving within the last 2 years. And he said, Daddy baby, don't worry. I think I've even tried. Because this is the same person that we have been managing for quite a long time. No problem. He doesn't even go to, he will tell you, okay, Daddy baby, no, I will get the drug. Go and get me those drugs from Lagos. He doesn't even go to my sister's place. I'm sure you don't know him. You don't know him, he's gone now. So, you know, in the public place, if it's those ones that go to the public place, like the general hospital and all those, this one I'm saying, he has money. So, he can easily, when he's taking the viral load with my sister, he does it every 2 weeks. Viral load done every 2 weeks. You know, not in hospital, not in general hospital where it's going to be done free. He's paying for it. But within the last 1 year or so, he started saying that, look, that baby, let me do this, sometimes I look at some beautiful ladies like this. This one will come to my clinic week. And you know, that is the medical aspect of it. I was telling somebody some weeks ago, he said that, look, Dr. Guy, why is it that somebody had this or something like that? Must you not tell so person or something like that? I said, it's not possible. I said, it is not possible. Even if I've secretly taken your blood, I've taken your blood, maybe for malaria. You may not know, even if I'm going to test it for HIV. If without you, I discover that you have HIV, the best I can do is to come to you, my brother. This is your secret, don't you think we have to do this. Any patient that really wants to be tested, like my sister probably must have told you, should first of all agree. You will see some patients, they will say, no, doc, do everything you think you can do, even including HIV, if you come from their mouth. But there are some that will say, look, don't test me for HIV. I don't want to hear, because I don't want to hear. Don't test me. And meanwhile, you already know this person has HIV. So, the best thing you can do is to keep your mouth shut. That is the simple truth. Because you can be sued. But if it's the type, if it belongs to the other side, who will say, look, doc, go and do everything. Maybe you've already done it. Then maybe after 2 days or so, you can say, look, there is something I can do and move. This is the result. The best you can do is to change the date to show that you have just done it. So there are so many things, and there are some people that will come. There are some organizations we have to do what we call test form. All workers, you must do all tests before they are given the full employment letter. There was this young lady came to me. She said, look, doctor, he said, you don't need to test me for HIV. So I said, why? He said, because it's positive. I felt like collapsing. Because if you see this lady, a typical young man can commit sin because of her. I'm telling you. So sometimes I wonder what is actually happening in the country. She said, I must not. And I dare not include that in the pre-employment test. I cannot. If he says no, you cannot. So, but what I am saying is that if you are the type that you say you don't want people to know, you must be ready to take care of yourself. You must be ready to take care of yourself. Somebody will come and tell me that hypertension kills, diabetes kills. It doesn't really follow. It has no cure and things like that. But a person who has diabetes and is still up to 80 years of age, has he not tried? A person that has hypertension and is able to maintain it to maybe 70, 80, 90, has the person not tried? So it's the same thing, my brothers and sisters. If this person decided to take care of himself, he will not be like this. And what comes out of it is what we regard as the full-blown AIDS. And what's the end? Death. Preventive measures. I heard her talking to you about this also. And I know some of my good friends here who also know so much about it. You see, when we talk about preventive measures, in majority of cases, when I'm with some of my friends, colleagues, I'm always at the other side of it. Because I used to tell my friends, not necessarily here, I mean my colleagues, both senior and junior, when we are talking about the HIV something, I think the best we should be able to tell the people to abstain. There is no name, another name for a thief. It's thief. People will say, it's corruption, it's this, it's that, or something like that. You are trying to change it, use words to clarify it. A thief is a thief, a spade is a spade. The best way and the only way you know you don't want to have this thing is to maintain yourself if you are not married. goodness sake, keep it. Keep that marriage. You know what my friends used to tell me, my colleagues? They say, look, Dr. Guy, when you talk like this, you frighten some people. I said, no, it's not a matter of frightening. They must know. It's like some people who find it difficult to talk about sexuality to their daughters. People talk, I look at some people, some young guys, they will say, look, Doc, cotton should be Ijebu-Ode, meaning that, please give me cotton. Tell me your wife has in her this thing there. No, I don't give out. If it is on public gathering and things like that, I will share. If my sister come now and say, give me cotton, she decided to give me cotton. Look, Doc, let's go on street something. I will share. But I'm telling you what is in me. How many of us, a young boy, a man, decided, because he's going to a party, put cotton. I see girls putting cotton in their pockets. And they go out because they're likely to have sex. How many of them know how to use condom? How many? That is the question. How many of these people that are given cotton, that rely on cotton, know how to use it? This is my groups with my colleagues. When we are discussing or arguing on HIV, how many? How many of them can actually maintain that condom during intercourse? How many? But many of them, I can tell you, not less than 50% of people who wear cotton during sex will get that cotton tear. Or we get that condom, some girls, I've had girls who have told me before that the condom will remove inside her vagina. It was after she now put her hand into her private part and remove it. What are we talking about? That is usage apart. Like I used to tell them, unless you want to tell me that you are able to gather all the young boys or the men together and teach them how actually to use condom. That is apart. Condom, before being used, do you know how many months they have stayed in the country? How many months have they stayed in the country? My brothers and sisters, I'm not terrifying you. I'm only telling you what I know. This is a tropical country. In a place like ours, these are things that are manufactured in temperate countries. By the time they get down here,